Yeah, my name is Dr. PJ Madam Rafi. Today we are going to discuss about antidepressants. So first of all, we'll see what is depression. Depression is a disorder of mood. It is classified into two types, that is unipolar disorder and bipolar disorder. Unipolar means the patient will have only one episode, that is depression phase. In bipolar, patient will have two phases, that is mania and depression. What are the major characteristic features in depression? We'll see. Sadness will be there, grief, feeling of guilt, weight gain, anxiety, hesitation, sleep disturbance. All these are major characteristic features of depression. Okay. So here, what are the major neurotransmitter will be affected? Mainly deficiency of norepinephrine and serotonin. Mainly serotonin will be effective. At the same time, there will be norepinephrine also decrease mildly. And there will be one more thing, that is decrease in brain derived neurotrophic factor, that is BDNF factor will be decreased. It will helpful in increasing neuronal plasticity, at the same time neurogenesis. Okay, because of decreasing norepinephrine and serotonin and decreasing brain derived neurotrophic factor will land a patient into depressive phase. Okay. So if you see here, so what is the major pathology? Decreasing serotonin and norepinephrine. So we need to increase serotonin and norepinephrine in the synapse. So if you see here, serotonin will release into the synapse. So it will be reuptake by serotonin reuptake transporter. So by inhibiting this one, we can enhance the availability of serotonin in the synapse. Okay. Samely norepinephrine also. Okay. So what are the drugs which will inhibit serotonin reuptake? Those are selective serotonin reuptake inhibitors, tricyclic antidepressants, serotonin norepinephrine reuptake inhibitors. Okay, these drugs will inhibit serotonin transporter, thereby they will enhance the availability of serotonin in the synapse. That's why they will decrease the symptoms of depression. Second thing is, once if is uptake into the neuronal, obviously it is metabolized by monoamino oxidase enzyme. Okay, by inhibiting this enzyme also will enhance the availability of serotonin in the neuron. Thereby it will release it further into synapse. So these are the drugs which will increase the availability of serotonin in the synapse. Those are SSRIs, TCS, SNRIs, MAO inhibitors. Okay. So what are those drugs? We will see in following slide. See here, MAO inhibitors will have moclobemide. Then selective cellular SSRIs will have fluoxetine, fluoxamine, paroxetine, sertraline, citalopram, escitalopram. These are the drugs. Next in CCS we have imipramine, amitriptyline, doxypam. Then in norepinephrine in reuptake inhibitors we have desipramine, nortriptyline. Then in serotonin SNRS will have venlafaxine, duloxetine. These are the drugs. Okay, these are all belongs to typical antidepressants. Okay, and in atypical antidepressants we have bupropion. This is the anti-smoking drug. Mainly smoking cessation will use bupropion. Then amoxicillin, amintopine. These are drugs belongs to atypical. Okay, these drugs all they will enhance the availability of serotonin and norepinephrine in the synapse, thereby decreasing the symptoms of depression. Next, what are the therapeutic uses? In therapeutic uses, there are two types. Psychiatric uses will be there, non-psychiatric uses will be there. In psychiatric, obviously depression, we are using antidepressant for depression disease and OCD, obsessive compulsive, ADHD, attention deficit hyperactive disorder, then PTSD, post-traumatic stress disorders. Then in non-psychiatric uses, we'll use it for migraine pain. Okay, analgesia we can use because of serotonin because this one. So next, smoking cessation. This is the main MCQ. What are the drug used for smoking cessation? Bupropion. Okay. Next, enuresis and bedwetting. Next, alcohol drive suppression also. Okay. So what are the major adverse effect? Major adverse effect will be here CNS endocrinological. In CNS, normally patient will have sedation, lower seizure threshold. In ANS, these are all anticholinergic symptoms. If you see dryness of mouth, blurred vision, urinary retention, constipation, these are all belongs to anticholinergic symptoms. Okay. Next, in coming to the endocrinological, we will have weight gain, sexual disturbances. Okay. So here in ADR, we have to remember CVS and cheese reaction. In CVS, we will have QT prolongation. That's it will get chance of developing arrhythmia. So should be cautious. Okay. When prescribing, you should be monitored mainly ECG. So, and next one is mainly cheese reaction. What is cheese reaction means? When patient is on MAO inhibitors, that is monoamine oxidase inhibitors, when he is taking tyramine containing foods like cheese, wine, all those things, what will happen when patient is in MAO inhibitors, right? So these are containing tyramine. So when tyramine will be accumulated, so this tyramine is a replacing agent for norepinephrine. When it is replacing norepinephrine in the synapse, what will happen? So obviously it is replacing, right? So norepinephrine will get released into the synapse. So there will be more releasing of norepinephrine into the synapse. What will happen? It will acting on more adrenergic receptor, that is alpha 1, alpha 2, beta 1 receptors. Alpha 1 what will have vasoconstriction. That's why raising in BP, hypertensive crisis. Okay, because of replacement of tyramine. That's all. Thank you.